Although it may seem like months ago, it was only on March 23rd, which was 35 days ago, that we issued an emergency order requiring the closure of all non-essential businesses due to COVID-19. For a little context, this was also the same day that the Commonwealth reported 1,000 tests per day for the first time. Quest had just come online and we were ramping up to an ambitious goal of 3,500 tests per day. We're now reporting anywhere between 8,000 and 10,000 tests per day and sometimes more, which makes us the #2 test per capita performer in the country among the big states. And obviously we think this represents progress, but sometimes it seems like a lot more than 35 days ago. At that time, we directed the Department of Public Health to also issue a stay-at-home advisory. These two decisions were absolutely necessary to slow the spread of COVID-19 and coronavirus. We know that those decisions have brought with them their own hardships. Kids out of classroom for the rest of the year, parents stretched to the breaking point, and at a time when we need it most, people are separated from those they love. People have lost their jobs, their careers, and in some cases businesses they'd worked on for many years. Not acting, however, was not an option. Without any effective treatments or vaccines, and only a few weapons that we had to fight this virus, those decisions were made to save lives. Since we acted, we've avoided the humanitarian crisis that we've seen experienced in so many other countries and healthcare systems elsewhere around the world. The people of Massachusetts have definitely sacrificed, and they've definitely played their part. And together with our world-class hospitals, medical workers, first responders, and emergency management response personnel, we have flattened the curve. While Massachusetts has avoided the spike in infections that would have broken our healthcare system, COVID-19 continues to very much be with us in many communities. Our overall hospitalization rates for COVID-19 patients have not dropped. They remain high, plateaued is the word I would use, statewide, and many healthcare facilities are still relying on their emergency surge beds to treat patients. There are still approximately 3,900 people hospitalized for COVID-19, and we reported through our testing an additional 1,500 new cases yesterday. And while many people talk about the fact that the vast majority of the people who have not survived COVID-19 were people over the age of 60, I just want to point out that the folks at Mass General and the Brigham have pointed out to us that 44% of all COVID-19 admissions, 40% of COVID-19 days, and 44% of ICU days for COVID-19 are people between the ages of 0 and 59. Yes, they may survive, but many of them have a very rocky and rough road to get from here to there. So today we're extending the timeline for all non-essential businesses to keep the physical workplaces and facilities closed to all workers, customers, and the public until May 18th, and the stay-at-home advisory also remains in place during this time. We're bringing every possible resource to bear in this fight to get back to the so-called new normal, and a lot of what's happened in the past several weeks has headed us in that direction. We became the first state in the nation to launch a tracing program that will serve as a powerful tool to spot and stop new cases. The mobility data suggests that our state's efforts to close brick-and-mortar businesses and our calls for social distancing have played a significant role in stopping and slowing the spread of the virus. We've also expanded testing, and our daily average new tests this week, as I said before, have hovered around 8,000 to 10,000. This far exceeds that goal that we set of 3,500 cases a day, tests a day, a very short while ago. We also expanded hospital capacity to create more space to treat COVID-19 patients and other patients in need of hospital care. And in some parts of Massachusetts, like Western Mass and Cape Cod, we have seen a decline in hospitalizations over the course of the past 5 or 6 days. Our hospitals are also reporting that more people are coming in to hospitals for treatment and medical care that's not related to COVID-19. This is very good news, as people who need serious medical care should feel safe and go see their doctors. At the same time, it's also important that we begin formulating a plan to reopen our economy on a phased basis. When the data suggests that COVID-19 is diminishing, we'll want to have that plan ready to start recovering the economic ground that we've given up during this fight. Today we're announcing a reopening advisory board that will inform the administration's strategies for reopening when the time is right. This group will work on a plan that occurs in phases. They'll help industries navigate public health guidance and implement safety measures for the new rules of the road. We've asked this group to produce their plan by May 18th. The advisory board will be led by Lieutenant Governor Karen Polito and Secretary of Housing and Economic Development Mike Keneally. Along with a 17-member team, they'll bring together public health officials with leaders in the business community and municipal government. We picked a fairly small group to ensure that this group could be productive in a short amount of time. There are many important voices that they will need to hear from as part of the conversations that will be led by the advisory board. The strategy was to pick leaders in different spaces who are connected to like-minded people statewide so that they can engage in that robust dialogue and report back the most critical information for the advisory group to consider in making their recommendations. One way I've thought of thinking about it is this group, while small, has a lot of people on it who are very qualified and represent a lot of geography and a number of different business models here in Massachusetts. There are many business models in Massachusetts, and we think this group will provide an opportunity for folks in different verticals to get together, talk to one another, and then speak with one voice to this advisory board with respect to how they would pursue operating under the rules and guidance that comes from the advisory board. This should make it possible for every voice to be heard, but at the same time will create a mechanism that establishes organizing principles for different verticals and different business models to relate and communicate with this advisory board. We do anticipate delivering updates on the board's work as time goes on.